sweet belly. My sweet belly. It's a sweet belly. Sweet, this sweet little belly. Oh,
Oh, hey there.
Good morning. How are you?
I'm great. How are you?
Good. Do you want us to have a Stanford medicine background?
Does it matter? Yeah, it's up to you. Yeah. Thanks for helping.
Thanks for inviting all of us and doing all of this.
Uh, I'm excited to have you. Uh,
Um, Sorry.
yeah. So just I'm waiting for everyone to sign in and then I make everybody co-host and
Okay.
we live stream this as well and record it. So hopefully that's okay.
It's fine.
Yeah. How have you been?
I'm good. I was just stalking some of my patients from yesterday. I was in the OR yesterday and I got called to help in procedure room 33, like the TEE room.
Hmm.
Sometimes it's like weird when you like, how you join in on cardiac anesthesia time. But it was like very satisfying and I got the patient admitted to CCU. They finally got admitted to CCU after they coded a couple times.
Oh
And they have
wow.
a Demi. And a 44-year-old, like in
Oh
a
wow.
TEE, like the 10-minute procedure. It was kind of crazy.
Yeah. Yikes.
Yeah, but hopefully doing better.
Yeah, hopefully more stable now, huh? Yeah. That doesn't happen in the outpatient surgery center in which I work.
Keep
It's
hearing
so
more and more
it's
lovely
so
things about,
chill. Huh?
I keep hearing more and more lovely things about Emeryville. Everyone wants
Oh
to
my God. Yeah, it's like a little slice of heaven. Yeah. There's a
know.
reason I work there and not at the main.
Yeah.
Yeah.
But yeah, I mean, you get your crazy when you're in the unit, and then you get your uncrazy when you're at
Yeah.
Emeryville.
I mean, when I was young, I was like, I want to do livers and trauma and bleh. And now I'm like, I will take that knee scope and that GI procedure. Yes, it's fine. I'm like, oh, I'm kind of over it, you know?
Yeah, I was on liver call on Sunday and I was up for almost 24 in a row and they did the split liver and neither half the liver was working and then they lost a needle in the belly. And I was like, I quit. At that moment when like 4 in the
What?
morning
Yeah.
was like, for the love of God, just let me drop this patient off and go home. But
That's too much. That
yeah.
is too much. Yeah. I've never worked at the main since 500p opened,
Mhm.
other than the ICU.
Yeah.
I just don't have any desire to, it's too big.
Yeah.
It's too much. Like I like little small ORs, I think, you know.
Yeah. We are expanding our like peri-op and like we're gonna have an inpatient pre-op service. So if you are interested in non-OR Stanford things, there are, I
No,
figured,
girl. I'm like,
you're like, I'm,
David Stahl asked me, he's like, so what are your career goals? And I'm like, dude, I'm like tapped out. Like I've been doing this for 17 years. I think I've done enough, like
they're just lovely days. You just get to hang, like most of the times, you just get to hang out with residents one-on-one and then take care of all your meetings and every now and then you run to a code. So they're not bad days. So if you change,
yeah, I'm sure, it sounds good, but I'm just like, I don't want to go down to the main any more than I have to. It's a 2 hour drive from where I live. Like I'm barely hanging on as it is with to my like Stanford career. Like
yeah,
it's really all my academic global health stuff that keeps me there. I mean, I love the ICU. The ICU is great. Like that's my happy place, but I just really don't have any desire to be in the ORs there. Okay, there's Danielle. Let me make her co-host. Um, yeah, anyway, I probably sound lazy, but
no, no, not at all. Considering all the work you're doing behind the scenes for all this stuff.
hey, Danielle.
Hey, how are you?
Good. Haven't seen you in a minute. How are you?
I'm good. I'm recovering from COVID. I was down for like a week. It was bad.
Really? I'm
Yeah.
sorry.
Oh,
I'm
it's all
sorry.
right. My voice is a little scratchy, but it was much
Yeah.
better than it was.
You
So,
can just seduce all of the participants. It's
oh,
great.
I don't know about that. Sound like I've smoked like 30 of my 32 years.
Thanks for taking a large portion of the slides.
Anytime, always.
Essentially my co-host, but
Love it.
oh, there's Fred. This is good. I get excited. This is so fun to me.
It is fun.
I know. Okay. Make Fred co-host. Yes. Good morning, sir. Welcome.
I'm gonna log in on my computer, so I'm gonna exit out here and you'll have to re-let me in.
Okay, no problem.
Thank you.
Of course. Let's see. How are you, Fred? Still figuring where that mute button is. Danielle again.
I found it. It was right where it was the last time I used Zoom.
That's so weird. That is so weird. Okay, Danielle. You should be
Good
able to.
morning, you mean Fred.
There you go.
Hey,
Okie dokie. This was a good one to put together, honestly. Like, I don't know that I've actually sat down and thought about like oncological emergencies. I mean, we handle them all the time, but I was like, huh, all right. How do you put that together in a lecture? So it's the first time I kind of put it all together. So hopefully it makes sense and is
I thought it was
no,
put
I think,
together really well. I liked how it
okay.
flows, personally.
Okay.
yeah, but there's just a lot of stuff. There's a lot of rabbit holes to jump down.
Mhm.
Careful. Don't
So
fall in. Don't fall
yeah,
in. Yeah. It's kind of just an overview. And usually we do case-based presentations, and I was like struggling to get that to fit. So I just did kind of more didactic, but hopefully it's okay. So we have Toby, Gaston, and Jackson joining us from Rwanda. Toby's
Where's
actually
Gaston from? Remind me.
Gaston is Rwandese, yeah. And so is Jackson. Gaston is now like head of a department, I think, at King Faisal Hospital. Jackson is like assistant program director for the residency program. Toby is an intensivist, and he is Nigerian and then worked in, I think, Botswana or Zambia, and then has been in Rwanda for a while now. So,
Awesome.
yeah, I know all of them fairly well. Hopefully they sign
yeah.
in.
Gaston was out in he was at the hospital away from Kigali. I forget where it was when I was
Gaston
up.
is, yeah, he was in Butare. He was at the other
Qatari, yeah.
hospital where the main university is. He's the only pain physician in Rwanda. So he leads like a lot of the pain management stuff. He's one of my absolute favorites, and he was one of my best students of all times. Like he's been out for many years now, but just super, super fun guy. And I'm really close to him and his wife and his kids. And every time I'm in Rwanda, they have me over for dinner, which is pretty rare. Like Rwandese, it's not very common to be invited to someone's house. So
Oh, so
yeah,
sweet.
yeah. So they're really, really great.
I had dinner every night I was there at his house.
Don't lie to me, Fred. You're trying to make me jealous.
Not that it's a competition, but
There is no competition. Fred has done way, way more than I have, which is why he got this humanitarian award at Stanford.
that's awesome.
Oh.
Congrats.
Yeah, you're getting the big award in October. Come on, let's not
I'm just
mince any
I'm just
words.
more self-indulgent.
All right.
No, actually, you know who nominated me? Hey, Nicole. Do you know who nominated me? Fred was Ed Mariano.
Oh, nice.
I know. I was like so flattered and like surprised by that. I was like, that's so nice.
Yeah.
Yeah. I thought it, if anything, it would be some of the Global Health Committee people, but no, it was Ed. It's like, thank you. That's great sponsorship right there. How's it going, Nicole?
Yeah, living the dream.
Yeah, you are. Yeah, you are.
Yeah.
All right.
Well, with your nice
scanning
background.
participants to get all of our co-hosts in. I think like all you guys kind of know how to do this. You've done this already, but yeah, once I start to screen share, I can't see the chat box or the Q&A. So if you guys can kind of help engage in
So are the
discussion.
questions coming through the chat or Q&A?
Yeah, so it'll end up being both. So I try to get them to introduce themselves in the chat and say where they're from, but put, questions that they want answered in the Q&A. However, that doesn't always happen that way. Let me see. Toby is texting me.
So what's the time frame? How many slides have we got, and how many minutes are we?
32, and then we'll have an hour and a half.
32 slides. Okay, okay.
Toby's asking me, how do you sign in? So, okay. Let me copy that and send the registration link to him. Okay. I'm glad it's if they don't, then I'll just cover their slides, Danielle. So we'll make it work.
Okay. I'm also happy to, whichever.
Oh, Pauline is there too. Nice. This is Toby's first time, so he's trying to figure it out. Did you guys have any questions about the slides?
No.
No? Okay.
One of my slides, the text seems kind of small.
Is that a me problem?
Well, maybe we can just
kidding.
zoom in
I'm
on the
kidding.
text.
Yeah, no, yeah, I think I know what you're talking about. I can try to zoom in, no problem.
I also think it might be
it'll
helpful
be
to
obvious
read.
when you get to it. Let me just
So
see which
the slides and the PDF have already been uploaded to the Learning Resource Center, so people can download those things now, and I'll mention that in the intro.
Okay.
So they can download that.
I think it's 27. There's like a body with a bunch of the implications or different.
Yeah, I mean, I think I've put that up just more for the fact that
Visual.
you can see it affects everything. Yeah. And maybe we could just mention like that, you can read this more closely, but it's really just to have the effect that
No, it's 19. It's slide 19.
Danielle, do you mind just kind of having the Learning Resource Center link copied and then just paste it into the chat? Okay, we have 3 minutes. Come on, Rwandese. Oh, there's Toby. There he is. Let me make co-host. Confirm. Good afternoon, sir. Hi, Toby.
Hi, Anna. How are you?
Very well, very well. Thank you for joining. I'm excited to have you.
Thank you. I'm excited to be here.
Wonderful. I'll introduce everybody in the intro in a few minutes. I don't see Jackson or Gaston yet.
I'm sure they will join soon.
Yeah. Okay, Danielle, with 2 minutes, do you mind looking for Jackson and Gaston and admitting them and making them co-host? Because I'm going to go ahead and get us set up for a few other things. My bandwidth is kind of narrowing. Okay, awesome. So I'm going to admit all the participants.